forward to welcoming you to our hospital's international courses.
We are delighted to launch the first international educational program series at Imam Reza General Hospital, Tabriz, Iran.
Tabriz is a historical and vibrant city.
You will love our beloved city.
Join us for our educational programs.
We'd love to have you here.
Waiting for nice days together.
See you soon!
Hello again. Today we're here again with one of the interesting programs of educational courses of Imam Reza Hospital, and I'm hosting one of the honorable and valuable guests that I've had, actually a friend of mine and also my colleague. He's a famous face for everyone who has watched these programs. Hello, dear Dr. Soleimanzadeh. I'm really happy to have you here, and not as a host, but as a guest. And I know that you have very interesting topics that we are going to talk about them, but please first introduce yourself to our audience.
Thank you, dear Dr. Sanai, for your kind words. I'm really happy and I appreciate your invitation, and thanks for this opportunity. I'm finally talking to this microphone. I'm Dr. Farzin Soleimanzadeh. I'm a urologist, assistant professor of urology in the Department of Urology in this hospital, Imam Reza Hospital. And I then, after graduation and after a few years of work, I was further trained in reconstructive urology, and I passed a 3-month course in Italy, in Turin, addressing more specifically the penile prosthesis implantation and artificial urinary sphincter implantation for incontinence. Now I'm working here in this hospital as a reconstructive urologist. I prefer mainly to focus on my subspecialty field of surgeries.
Yeah, it's great. I know that you will train the participants with 2 of your expertises here. And let's talk about the first one at the first. What is the title of this course?
I am going to provide 2 courses and talk a little bit about these 2 courses. The first one is a male urethral surgery. Male urethral strictures or stenosis is a rather prevalent condition, and even seems that it is kind of increasing. In terms of prevalence. I'm subspecialized on doing surgeries for these kind of problems. Urethral strictures, because of different causes, different etiologies, and different techniques we have for urethral reconstruction, sometimes end-to-end anastomosis, and sometimes for longer strictures we use buccal mucosa grafts. And we provide a graft from mouth, from different parts of the mouth, mainly from cheek, and we increase the diameter of the urethra at that part. It is a lovely surgery. I mean,
It's really interesting. Yeah, it is.
And the course is about these detailed surgeries. Most of the urologists mainly prefer not to do these kind of surgeries because they have some several minutiae that you should take care of about them. I'm going to provide at least 3 months course. We will talk a little bit more about the details. Course for the urologists or senior residents who are interested in doing these kind of surgeries.
Well, that's great, and it was really interesting when you was describing it. I was listening with great eager. And what are the objectives of this course? I mean, what you expect the participants to achieve from this course?
As I told before, I expect that first of all, as a prerequisite of this course, we consider that the person who comes for the course is a certified urologist or at least senior resident that can deal with these minutiae without going into the more preliminary educations about surgery. So we will go on with technical details and knowing about how to choose which technique for every individual patient. So the course addresses evaluations, anatomical considerations, etiological considerations, age problem, and different considerations about choosing the best treatment option for the patient. And we expect the participants to gradually know how to manage each case.
Great. So as you said, I just want to emphasize this part that so the eligible participants will be senior residents or urologists themselves interested in this field.
Yeah, exactly.
That's great. And what about the duration of the course? How much time is needed for a urologist to learn these techniques from you?
Yeah, based on our load of patients, I expect that at least a 3-month course is necessary to be a good decision maker about the details of techniques and selection of techniques. So I think the minimum time for the course, based on the hands-on nature of the course, that I expect at least at the end months of the course, the participant will be hand-on. So I think a minimum of 3 months is necessary, but it can be extended up to 6 months based on the needs and preferences of the participants.
Okay. You talked about the load of the patients, these kind of patients. Maybe this is not the right question to ask, but I was wondering, during a 3-month course, how many surgeries of this kind a participant you expect to see?
I can say that because these surgeries are rather large surgeries, sometimes 4 hours, 3 hours, maybe 5 hours. So I cannot do, for example, 3 surgeries in one day. But there is almost every week we have 1, 2, or 3 cases in different days of a week. So I think this load of patients is quite enough, appropriate for a participant to see different types of urethral problems and their management.
Yes, so yeah, you're right, because maybe even more than 30 patients during that 3-month course can be seen. Yeah. Thank you very much. And I wanted to know about your expert team, the colleagues that work with you in this procedure.
Indeed, I work with many of my colleagues. Some of them are interested in some types of treatments especially endoscopic treatments for small, minimum involvements of urethral strictures. Some aspects of female urethral strictures are managed with a team of our experts, our head of department, Dr. Haji Ibrahimi, Dr. Jahan Tabi, who are mainly concerning with female urology, functional urology. So we work with each other in department, and going to the reconstructive surgery for urethra, it is almost my own interest and field of action.
So you are the expert man in this field, yeah, in this area, of course. And is there any other thing you want to mention about this course? Maybe I forgot to ask about it.
I think we touched everything about this course. As far as I remember, I told that the course is hands-on, starting from by some lectures about anatomy, about patient selection, and then going to the details, and the participants will be hands-on, but the level of being hands-on depends of the basic abilities and capabilities of the participants. There is no restriction about this, and we will decide together with all of the members and participants how they can be involved. And the duration of course, and we talked about everything.
We talked about it, yes. Thank you very much for great explanations. And now let's talk about the other course of you that, again, it's your expert field, but let's tell the audience the title, and then we will talk about the details.
Yeah, the second course is about transgender patients and the surgeries that are mainly known as sex reassignment surgeries or gender reassignment surgeries. I prefer the first one, of course. Sex reassignment is rather precise. So these surgeries are done in transgender patients, and the evaluations based on the rules here has been started very previously, and when the patient comes to us, it is mainly the last step of their evaluations and treatments. And we have started these surgeries about 5 years ago, and now our center is considered as one of the rare centers in the country and the only center in northwest of Iran to do these kind of surgeries, both female to male and male to female, both of them, with different techniques based on patients' anatomy, patients' expectations, and what we prefer to achieve as a result. So it is very crucial to know what is the patient's expectations and goals after surgery, because it is very it should be addressed very clearly. We have different techniques. We recently, from about 2 years ago, we started the technique of vaginoplasty by sigmoid segment, which provides a little bit more depth of vagina, functionality after surgery, but in the meantime is involving another part of the body going to the alimentary canal, doing an anastomosis, so potentially it has more potential for complications after surgery. There are many considerations here. So we, for a better result in terms of total result and cosmetic result, we started laparoscopic sigmoid segment vaginoplasty from 1 year ago with one of my valuable colleagues who is a laparoscopist, gynecologist, Dr. Reza General. And we have done 6 surgeries up to now, 6 totally laparoscopic vaginoplasty. It is really interesting. It's an honor for me to say that this is the first time in the country, and the centers doing this surgery are rare worldwide. And we can provide these different types of techniques for sex reassignment surgery.
I think I just saw a video of your surgery in your Instagram account, and it was really interesting and fascinating that you're doing such a work. And I wanted to add a sentence. If I'm wrong, please correct me. As I know, you are the only urologist that you do these kinds of surgery in northwest of Iran.
Yes, in northwest of Iran, as far as I know, at least. Yes, it is right. You are right. In Tehran, in Mashhad, in some other centers like Shiraz, I know that some of my colleagues doing these types of surgeries, but in northwest of Iran, who hosts about 20 million or more than that, I'm the only surgeon, and here is the only center doing these kind of surgery. Say that I recently have patients from southern parts of Iran, from northeast of Iran, central parts of Iran, because our center is providing different types of technical variety of surgeries. I feel that from northeast, from southern parts of Iran, we had now patients, yeah.
Great to hear that. We are really proud of you. And about the objectives of this course and what you expect now from the participants that attend this course.
For this course, I believe that a surgeon who is interested enough for going through such a big surgery.
Big challenge.
Because, yeah, it's a really big challenge for surgeon, because even physically you should be prepared for such a big surgery, about 6-7 hours, a non-stop surgery. If you are a team, you have the opportunity to change your position. For example, in laparoscopic surgeries, I have a break time in the middle of the surgery, but
to breathe a little bit when you're alone.
But when I'm alone, you should be prepared for a continuous
6-7
hours. Yeah. So if someone is interested in these kind of surgeries, I expect that based on the load of our patients, almost 1, 2, 3 in a month, I think a participant can be able to do these kind of surgeries based on the basic capabilities in 3 to 6 months again. 3 months is a little bit optimistic, I think, but 6 months is quite good. Yeah.
Yeah, great. And I think you talked about your colleagues that work with you in this field, especially in the laparoscopic technique, I mean. And any other thing you want to talk about this course?
Course again is hands-on, so the participants will be involved directly in the surgeries. And it is very important to talk, although we urologists do not directly do the pre-evaluations of the patients coming to the end of their surgery stage, but it is important to know some details about the possible other diagnosis which can mimic transgender patients, but indeed it's not. And the cultural differences, the availability of talking about this in different countries, in different cultures, even, subcultures inside a country. These are very important considerations, and I myself try to be involved indirectly, not officially, but for my better imagination and understanding of these patients. I've done 2 different theses regarding these patients, qualitative researchers, talking to them to understand what is their expectations and how they fulfill or they don't fulfill their expectations after surgery and treatment.
Exactly, that was what I was going to tell, but you said, because in one of the thesis defenses I attended, and it was a very interesting topic with very nice results. It was, as you said, a qualitative research. Maybe on 6 or 7, the sample size, if I remember right, was 7, but
it was 9, I think.
9.
Yeah.
But really full of great information about their feelings, about their experiences, about our culture that they are living in this country. And it was really interesting. And I should add that besides the surgical techniques that the participants will learn, because you are a good researcher also, maybe they can do research in this field during the time that they are here hands-on up in the operation room, but also they can do it.
As far as we have colleagues like you, it is possible. I don't claim that I'm a research man. You are expert of this field, but in the meantime,
don't be that humble.
Thank you for your nice words. In the meantime, it is possible. I really care about these issues about these patients because it is quite attractive and interesting for me.
Thank you very much. It was a really great interview. I learned a lot, and maybe one of the best interviews that we had together here, being as host and interviewer. Thank you very much. I should mention to the audience that, like other programs, if you have any question, you can contact us, contact our support team, or visit our website. Thank you very much.
Thank you.
Thank you.